Good morning, good afternoon, and good evening. G'day from Melbourne, Australia. Yesterday, I went off to a place called Clayton, where they have this hospital called Monash Medical Centre. I had to have this series of tests again. 14 vials or 14 tubes of my blood. So it's gone from like, I think I had the first time was about 10 or something, and then the next could have been 12 or something around there. And so this time we've upped it to 14 vials. So this test is similar to the previous test, except this time I had to watch out for not to drink any tea, coffee, anything that's going to make any change in the sort of molecular structure of my blood. So as tea and coffee are two particular things that do sort of thin the blood out a little bit. So now I've got to wait for those tests to be to come back to the haematologist, which I'm seeing on Thursday. So today's Tuesday, so in 2 days' time I'll see the haematologist and get the feedback from those results from that test, and hopefully, fingers and toes crossed, we'll have some sort of confirmation on what's going on the inside in my veins. I'm looking forward to, in a sort of way, to know exactly what's going on so that we can move forward. If in fact I do have this particular genetic disorder, blood disorder / condition / syndrome / disease, then we will look at what the treatment is. So basically that is to replace whatever's missing or whatever my body is not actually providing for me, so that we can ensure a smooth outcome to getting my knee fixed, getting it all, put back together again and functioning, so I can, move forward in life with leaps and bounds. We will certainly find out what happens on Thursday, this coming Thursday. And then, of course, I will assume, and I don't always do that, but I will assume that my follow-up appointment with my surgeon will give me some insight as to when surgery will go ahead. So once it does, we can get back on track, especially with this, documentation of my journey with, the whole surgery thing. Feel free to give me one of these. That's cool too. Subscribe. You can also offer any suggestions, feedback, or advice down below, or share your own story with me. Anyway, all right. Okay. Yes, that's enough. Bye.